Well, as far as oral surgery, I don't do all the oral surgery. I will refer some oral surgery out. I like to complete for patients things that I'm familiar with, that I've been trained on, and I've become really good at. Those would include most extractions for patients. In today's environment, we try to take teeth out with very little trauma, and so you have to have the right instruments and training and experience sometimes just gives you that ability to do that. By getting the tooth out atraumatically, that means you leave the bone around the tooth alone so that you can it's easier to place an implant in good, solid, good shaped bone. That's why you'd like to make it atraumatic as possible. So we remove teeth. We do socket preservation, which means if we're planning to do an implant, we want to preserve as much bone as possible and to make sure it's shaped in such a way that we can placing an implant makes it easy and aesthetic when you get done through doing the crown. So we do bone grafting of the sockets and some grafting of bone where it needs to be reshaped using a membrane to help us, which helps to the bone and the gum tissue to form in the correct way so that we have a good result to place an implant. A lot of people are a little anxious about oral surgery when they hear it. When I think about going to having a tooth taken out, I get a little anxious myself. So, but I'm able to control that, and I go through it with knowing anesthetic, with a local anesthetic, that I'm not going to feel it. We can make sure that you don't feel anything today with the techniques we have for anesthesia. But if you are anxious, we can give you something that you take the night before and an hour before, which really cuts down on your anxiety. You have to bring somebody has to bring you and take you home. And then we have the conscious sedation and the IV sedation, which we have performed by a dental anesthesiologist that comes to our office to provide that for you. We don't want anybody to be in any pain or anxiety when they have those things done. And so we try to minimize that by the things we offer patients when they have those procedures, if they choose to.